I'm Dr. Lauren Mathewson, and today I'm going to be discussing high-dose vitamin C IV therapy. I'm talking to you from Revolution's Naturopathic today. So vitamin C is the same thing as ascorbic acid. They are, one is the molecule name, one is the common name, and we all have a pretty good idea of where we get vitamin C. It comes from our foods. A little bit of background about vitamin C and why we love it so much. So it is most commonly known for its wonderful antioxidant properties. Vitamin C has a very strong, potent redox potential, and that's due to its ability to donate electrons to oxidized molecules. So vitamin C protects the cells that we need protected, things like our proteins and our lipids, our carbohydrates, and DNA and RNA from damage from reactive oxygen species, hence it being an antioxidant. It plays a really important role as a cofactor, and cofactors are molecules that assist enzymes and other important processes. So we know that vitamin C is fundamental and it's crucial to a lot of different processes. The dietary sources of vitamin C, certainly we know that veggies are kind of the most abundant source. Things like guava, kiwis, bell peppers have the highest sources of vitamin C. Other things like broccoli is really high in vitamin C. A little lower on the list are things like citrus that we always kind of associate with high doses of vitamin C. Vitamin C, again, primarily fruits, primarily veggies. There are small amounts of vitamin C in animal meats. Animal organ meats are going to have slightly higher, more modest levels of vitamin C, and animal muscle meats have pretty low levels of vitamin C, in particular if those muscle meats have been cooked as we do when we're eating animals. We really lose a lot of that vitamin C. So again, we need to rely on dietary sources really from plants and veggies. In terms of vitamin C bioavailability, there's a pretty big spread. So starting from the least bioavailable to the most bioavailable, on the lower end we have oral vitamin C, and that can either be, again, the vitamin C that you're getting from your foods or vitamin C supplementation that you're taking, either recommended by your doctor or something that you've picked up at a health food store. So the oral vitamin C, you know, you can really take in, we say like dosing is probably a gram or two every few hours at the most. And as you all know, if you push vitamin C too hard, if you take too much, your GI tract is going to stop absorbing it and you give yourself diarrhea. So just, it's a pretty clear picture of too much vitamin C and stools have loosened up. So the oral vitamin C is kind of the least available for our body to use. Then in the middle, we have liposomal vitamin C. And liposomal vitamin C is vitamin C that has been encased in a fat-soluble membrane. So generally, it's something like phosphatidylcholine, which is from sunflower seeds, are going to be emulsified around that vitamin C, making it all that much more available so that when you do take liposomal vitamin C orally, it's absorbed much better into your bloodstream out of your GI tract than, let's say, you know, a chewable vitamin C tablet would be. But it's still, we're still not getting really significant levels of vitamin C in the bloodstream from either oral or liposomal. And then that's where we get to the most bioavailable route of vitamin C, and that's intravenous. So just like everything else, we know that if we're able to access a peripheral vein and we're able to infuse our nutrients into that vein, we know that exactly whatever I'm prescribing, that is the dose that that patient is going to receive. Whereas when I prescribe things orally, we say, gosh, I hope that they absorb some or most of that, but there's not really any guarantees. Whereas when I'm giving something intravenously, like I know if I'm giving 50 grams, the patient is getting 50 grams of vitamin C. There certainly are some preliminary studies showing that IV administration of vitamin C can reach blood concentrations that are 30 to 70 times higher than the same oral dose. So what that means is if I gave the same oral dose, let's say I gave someone 5 grams of vitamin C orally versus 5 grams of vitamin C intravenously, that the intravenous vitamin C, we're going to have 30 to 70 times the levels in the blood as I would get from that oral administration. So that is a very significant difference. There's quite a bit of interest in terms of using intravenous vitamin C with cancer patients. The history behind this is 1976, Linus Pauling, who was a Nobel Prize winner in chemistry. He found evidence suggesting that IV administration of vitamin C would be useful as supportive treatment for cancer, as additionally as a way to help minimize treatment side effects. His protocols and his early experiments, he was giving vitamin C intravenously to terminal cancer patients and found that people who received vitamin C infusions lived longer than those who didn't. One of his protocols was giving 10 grams per day to these terminal cancer patients for 10 days in a row. And 10 grams isn't really a ton to be given intravenously. You know, I kind of think of that honestly sort of a touch of vitamin C intravenously. So this wasn't mega dosing. These patients, you know, they did 10 grams a day for 10 days in a row. That was their only intervention, and found that those patients on average lived 210 days longer than their peers who did not receive that intravenous vitamin C. So this is really interesting and exciting work. Certainly there have been criticisms of Pauling's research. The primary critiques are that lack of standardization and a lack of controls. But I certainly think that it's worth considering what's been done in the past as we move forward. There's studies showing that high-dose vitamin C has significant benefit for glioblastoma patients. Glioblastoma are those brain cancers that can be very aggressive, and there's not a lot of great treatment options for them. So, you know, there was a recent phase 1 clinical trial done. It showed that 13 patients who were receiving high-dose vitamin C along with their prescribed chemotherapy and their prescribed radiation, that they had an increased survival time in the high-dose vitamin C group, and that survival time was 18.2 months versus 14 months. Now, I know that that doesn't seem like a lot, right? That you're saying, okay, that's 4 months time, but 4 months time, sort of 4 months at the end of life that gives you time to spend with your family and spend with friends and kind of wrap things up. You know, that is significant, and that's significant for the people who have those 4 extra months. High-dose vitamin C has also shown some demonstrated benefit for things like pancreatic cancer, which is another one of those aggressive cancers that doesn't have a lot of great treatment options. There certainly are some options, but a lot of times they're quickly exhausted. We found that 2 recent studies demonstrated that patients who were receiving high-dose vitamin C were able to reduce tumor size and promote trends toward longer progression-free survival when compared to chemotherapy alone. So again, you know, I think that's really something worth investigating. And let alone the benefit in terms of survival time, we're also seeing these really wonderful quality of life benefits from patients who are using high-dose vitamin C intravenously. What I expect to see when patients are using high-dose vitamin C is improvements in things like energy levels, appetite, stamina, kind of mood, how people feel overall. I'm looking for an improvement. And, you know, in some of my sicker patients, even a little bit of improvement to sort of their nausea or their fatigue has a significant quality on their impact of life, or significant impact on their quality of life. So, you know, we take every advantage we can when it comes to things like that. We also see there was a study of 39 patients who, again, were receiving just 10 grams of IVC, and they did that twice a week, and they reported improvements, again, in physical, emotional, and cognitive status, in addition to experiencing reduced fatigue, reduced nausea and vomiting, reduction of pain, which is really wonderful. We can get some anti-inflammatory benefit from using high-dose vitamin C, and then also seeing a benefit to appetite, where people's appetite came back online a little bit. Vitamin C, the mechanism of action. This is a really interesting one. You know, we didn't, even up until I'd say within the last 10 years, we've still been working on sorting out kind of what is it that vitamin C does intracellularly that's so beneficial for cancer patients. So one of the things, the way that we can use vitamin C is that structurally the molecule of vitamin C is very similar to that of glucose, which is sugar, and every cell in your body has receptors for sugar and wants to slurp sugar up every chance it gets. So if we go in and let's say we access a vein and we're infusing vitamin C, every cell in that patient's body is going to think, oh my gosh, we've just hit the sugar jackpot, and it's going to go to kind of slurp up that vitamin C. Once the vitamin C is inside the cell, it's able to interact with little bits of stored metals inside the cell, whether it's iron, different metals, and the interaction between that vitamin C and that stored metal causes a burst of hydrogen peroxide. Hydrogen peroxide is damaging to cells. Now, normal healthy cells contain an enzyme called catalase. Catalase is able to quench that hydrogen peroxide reaction, and that cell is able to just kind of keep carrying forth with extra stores of vitamin C intracellularly now. Disease cells, such as cancer cells, aren't making as much or any catalase. So using vitamin C is one way that we could potentially, hopefully, weaken cancer cells from within. The way that we dose vitamin C is when I start with a patient, we kind of start at this lower end of dosing. We do a test dose of 25 grams, go up to 50 grams, and then keep escalating that dose as needed. What I'm looking for is a variation of before and after glucometer reading. Now, I'm using a glucometer, which is, you know, you do a finger poke and it tests for your levels of blood sugar. The glucometer is going to read that vitamin C as blood sugar. So the glucometer is an easy way I can do in office to, as a patient comes in, get a baseline of what their blood sugar is before we give them their IV, and then do that same finger poke at the end of the IV and see what is the difference in reading between before giving this IV and after giving the IV. And I'm looking for a difference of at least 350 to 450 points. That tells me I'm up at that therapeutic range where I'm going to be having the most benefit from using vitamin C with that patient. Certainly, there's a lot of variety in the different high-dose vitamin C cancer protocols. I feel very confident about using high-dose vitamin C alongside chemotherapy and alongside radiations. Please remember to always check with your physician before starting any new protocols. Make sure that the chemotherapy agent or whatever immunotherapies you're doing play nice with vitamin C. So we want to make sure that you are doing this under the supervision of someone who's trained in this. And then frequency of IV therapy varies patient by patient as well. So it can be as often as getting IVs 3 times a week during active treatment phases, or if someone, let's say they've achieved remission, they have no evidence of disease, we may still bring them in and say, let's keep you coming in once a month ongoing, is sort of a maintenance policy to prevent any sort of cancer recurrence. There are a few contraindications to using high-dose vitamin C. So certainly kidney, liver, and heart failure are all big contraindications to giving anyone fluids of that sort of volume at any time. So because the kidney and the liver process the fluids that we're putting through the body, if we're having issues with those organs, then doing a high dose vitamin C that necessarily comes in at least half a liter of water, if not more base fluid, that's going to be a lot of fluid to put through those organs. Same with heart failure. People with heart failure, we need to restrict fluids with them sometimes. So these are some pretty clear contraindications to high dose vitamin C. Couple things to remember: come well fed to your appointment and come well hydrated. Now, the vitamin C, because your body thinks that it's getting a big infusion of blood sugar, if you come in on an empty stomach and I give you a high dose vitamin C IV, I'm going to make you feel hypoglycemic and pretty lousy in about 15, 20 minutes, half an hour. So it's important that you come in, you've got a good belly full of some sort of protein, whether it's animal-based or nut and seed-based. I also want you to come in well hydrated. So I am giving IVs, but this IV, because it's so concentrated with all the vitamin C, it's hyperosmolar, and it, in a sense, can actually be dehydrating. So we want you to make sure that you've had plenty of fluids and you're feeling good when you come in for those visits. In general, high dose vitamin C treatments take about 90 minutes. And there is a little bit of lab work testing that's required up front. In particular, we need G6PD testing before I give anyone higher doses of vitamin C. G6PD is an enzyme that makes sure that it's that I can safely give you these higher doses of an oxidative therapy and not cause damage to your red blood cells. Now, this is a great segue in. Remember when I first started chatting during this talk about vitamin C, the first thing I said was, we all know this as a wonderful antioxidant, and it is. Vitamin C is a beautiful antioxidant. Now, there is something very interesting and unique with vitamin C, where as I start escalating doses up, there's a certain spot, we'd say it's around anywhere from 25 to 50 grams, where vitamin C stops being oxidative and chips over into being an oxidative therapy. So it's not an antioxidant anymore. Now it's acting as an oxidative therapy. A lot of cancer therapies are oxidative. So chemotherapy is oxidative. Getting radiation is an oxidative process. It's one of the things that makes high dose vitamin C so great for use with oncology patients is its ability to act as an oxidant. At the lower doses, again, remember it's an antioxidant, but upper doses it becomes oxidative. So that's just a little fine point to remember. I've got a few references for you. Dr. Rhonda Patrick, she is a PhD and she studies nutrition. She's got this great website, foundmyfitness.com, where she's done some really lovely write-ups on vitamin C. She got interested and excited about vitamin C recently, and it's kind of nice when sort of these old vitamins kind of get a new polish on them, right? We all know how great vitamin C is, but it's cool when it gets a little more attention. And then I've got another reference right here from 2018 discussing using vitamin C, high dose vitamin C, to mitigate damage from radiation in normal tissues. So this study was showing that patients who have pancreatic cancer and were also receiving radiation, they had less collateral damage to their healthy tissue when they were using high dose vitamin C therapy. I use high dose vitamin C therapy with, I would say a very significant amount of my cancer patients. And it's a therapy that I've found to be very well tolerated. It's safe so long as, you know, we're watching kidney, liver function, and patients feel really good with it. So it's certainly something that if you have any interest in, I encourage you to reach out and ask questions. Here at Revolutions, we do little complimentary free 15-minute consultations for patients to book an appointment with the doctor, see if we have services that are going to be useful to you, see if we're going to be a good fit. So please don't hesitate to reach out if that sounds interesting to you. Okay, thanks so much. Bye-bye.